Hi class. So this week we're continuing with chapter 5 and we're going to look at community needs assessment. After this week, you should be able to define 4 different perspectives on need and describe strategies for the assessment of community need. You will also be able to describe a variety of strategies for the evaluation of programs and explain the method and the purpose of each one. So this chapter deals with the application of research methods to answer some very practical questions about social work services. Is social work program needed? If it is, does a social work program work? If it does work, is it cost effective? So basically, the chapter provides a basis for social workers to engage in the role of a researcher using research-based methods to evaluate programs within their own agencies and their own communities. So the research process and methods that are used to answering these questions related to the planning, evaluating, and improving social work programs is what we call program evaluation. So to understand program evaluation, we must clearly define what we mean by program and work. A program is a set of activities designed to reach specific objectives. A program can be used to produce change at any system level. Programs can involve clinical change in individuals and families, whereas others can change organizations or communities. So, for example, a program can focus on a specific objective, such as improving communication among individuals. It can also focus on an entire agency's activities, such as a program to reduce targeted violence. So, regardless of what the scope or the purpose is, all social work programs are intended to improve the quality of life for people. As long as the program accomplishes this goal, then we can say that the program works. So, there are 2 different types of evaluation. We have formative evaluation and summative evaluation. Formative evaluation is research that is conducted for the purpose of informing program improvement efforts. For example, explaining immunization levels of program participants compared to overall immunization completion rate in the state may indicate that the program is doing well or that the program should be doing better. So, formative evaluation is directed at collecting information that can be used to target improvement efforts. So, some questions that you may ask during the process would be, are the goals and objectives stated clearly enough to enable us to evaluate the program? Is the program even needed? Is the program being delivered as intended? Then summative evaluation is for the purpose of judging the overall effectiveness of the program, and it also lends itself to decision making about the future of the program. So based on the information from the summative evaluation, important decisions will be made regarding whether or not the program should continue to be funded as it is, or should it be terminated, or if it needs to be expanded or revised. So some questions in terms of your summative evaluation would be, is it producing positive changes in the quality of people's lives? Does the program produces an impact on the larger community? Needs assessment is a form of program evaluation. So before you can develop a new program, sometimes you may have to do a needs assessment to see whether that program is even needed, right? So needs assessment is the application of research methods to determine the nature of the problem, whether the problem warrants a service or a program, and whether the services currently exist to address that problem. So you're looking at several things when you're doing that needs assessment. First of all, you want to know how big of a problem it is, right? Then you also want to know whether there's already a program available that's addressing that need. So with the needs assessment, you're looking at how serious of a problem it is. Then you're looking to see whether that problem even needs a service or a program to address it. And then you're also looking to see whether there is currently a program or a service already available to address that problem. Also, in addition to that, if there's a need, then a need assessment helps to basically identify the most effective programs to meet that need. So if there is really a need, whenever you do a needs assessment, it helps you to determine the most effective method or the most effective service to address that need. As you're doing that needs assessment, here are some questions that you may want to ask. What is the extent of the unmet need in the community, right? So how big of a problem it is, how much of a need is really there. Are there enough people in need to justify a program? So just because there's a need does not necessarily mean that you can justify creating or developing a program, right? If there's a need for one or two people or for just a very few people, that may not be enough to justify you developing an entire program. Do people know about an existing program? If so, how do they perceive it? So, even though there is a need, what about, is there already an existing program? Do people know about it? And how do they feel about it? Because if there is an existing program but people don't know about it, then instead of developing a completely new program, you will need to develop a plan to inform people about the program. You also want to know how do they feel about that program if they already know about it. So if they have negative feelings about their program, then you need to find out why, and maybe then you can try to figure out how to change your views about the program. If you do develop the services, will people use them? So that's something else you have to ask yourself. If you do create a program, are people going to use it? Those are other questions that you can ask during your needs assessment as you're trying to figure out, what's the best way to implement the program within that community. Where should services be located? So again, another important thing, you need to figure out what would be a best location for these services. You have to make sure that people are going to be able to access it. What barriers prevent people from accessing existing services, right? You need to think about that as well. And during your needs assessment, that's information that you need to be collecting. So what are some barriers that are preventing people from accessing those services? Whether it's transportation, whether it's money, whether it's time, they may not have time, maybe work. Find out what those barriers are. That way you can figure out a way to address those. And then, how do stakeholders view the need for new services or the usefulness of existing services? Asking these questions will give you plenty of information to be able to determine whether, a new service is needed or whether there's already a current service that you can just use, or maybe that you can bring more awareness to that current program, and whether there's any barriers or things like that, just so that you can develop the most effective services for that need. Okay, so again, there may be different types of needs as well, and as you are doing the needs assessment, you'll probably figure that out. So the first one is the perceived needs. And with the perceived needs, these are what people say that they need. So not what the researcher says, not what the social worker says, not what the therapist says, but what the people say they need. So those are what we call perceived needs. So perceived needs is generally assessed directly from the people affected or involved, and these are done through surveys, focus groups, and community forums. So expressed needs is a need expressed in action. So consider the saying, for example, that people vote with their feet. Or consider a scenario in which 30 students come every week to an after-school program that is designed for 15 people. This is an expression of the need for an expanded program. So if you have documentation from a waiting list or any other agency's records, it can also be a source of expressed needs. So expressed needs often underestimate the actual need. For example, if students know that the after-school program is always crowded, many of them may not come, right? They may not attend at all. Or if a program does not exist, people may not have enough information to ask about its development. Also, another issue with expressed need is the cultural acceptance of help-seeking behaviors. So in some cultures, admitting to a problem or reaching out for help may be a sign of weakness or a cause for shame. So there's different things that may affect expressed needs, because although expressed needs is something that is expressed in action, so if you look at your agency's waiting list or your agency records, you can tell if you have a waiting list. You're serving people, but you also have a waiting list of all these people waiting for those services. That tells you that it's a need, right? It's an express needs, because you can tell that you need more services, or you need to be able to provide more services to those people who are still waiting for help. However, it can also underestimate how much of a need there is, because, like, the examples where if people know that, if, for example, with the students in the after school program, if they know that it's always crowded, they may decide not to come. And so if they decide not to come, then we are not going to be able to see that need, and we wouldn't be able to tell how much of a need there is. Also, with when you think about the different cultures and how some cultures don't believe in asking for help or seeking for services, that would also underestimate that there really is a need there as well. Okay, so those are some problems with the expressed needs. Normative need is a perceived need defined by experts. So, not by the people themselves, but by people who are experts. A normative need reflects what the experts believe that people generally need based on a set of data or criteria. For example, poverty level or a food pyramid, right? Those are basically something that's standardized, something that was created by experts to tell us, this is the poverty level. If you fall within this level, then you're either below or above the poverty level. The same thing with the food pyramid. Experts came up with what that should look like in terms of how much fruits or how much vegetables we need to have each day, and things like that. Accrediting organizations that are guided by professional standards are also another source of normative need. So, for example, the CSWE, the Council on Social Work Education, is an accredited organization. They are the ones that provide accreditation for the social work programs. They're the ones that tell us what policies we need to follow. So, with relative need, it's basically comparisons with similar population of what they indicate is a need. This approach is sometimes what we call rates under treatment. So, for example, if most communities of about 50,000 residents have at least one group home for individuals with developmental disabilities, it may be reasonable to assume that my community of 50,000 people needs a group home. Or census data information from other surveys and rates of people under treatment in other communities can also be used to show relative needs, and they may be an inexpensive way to conduct a needs assessment. However, we must be careful to justify that the compared groups are truly equivalent in important ways. So basically, with relative needs, what we're doing is comparing similar situations or similar communities. So if you look at a community with 50,000 residents, and so if you look at a community with 50,000 residents and they require about one group home for at least one group home for individuals with developmental disabilities, then you can assume that if your community has about 50,000 residents as well, that you would need to have at least one group home. Okay, so basically with relative needs, you're basically comparing one community with another, and that's how you would be able to judge how much services or how many programs you may need within that community based on what's effective for other communities that are similar to yours. So here are some research methods for needs assessment. So there are different ways for you to collect the data that you need for your needs assessment. The first one is surveys, and these can be mailed surveys, they can be telephone surveys, or even face-to-face interviews. So you can decide to just send in your surveys, mail in your surveys to the community. You can do phone calls and do the surveys over telephone, or you can also, just go door to door and do face-to-face interviews, or you can just let people know about the interviews and have them come to the. We've covered these different types of research methods in the past, but just as a reminder, surveys are very good for large samples, especially if you want to generalize the information. it can be used for felt or expressed needs. Then we have the focus groups. With the focus groups, these are generally, it can be anywhere from 5 to 10 members. It can last for about 1 or 2 hours. And whenever you're doing a needs assessment, participants will discuss their perceived needs and their expressed needs in some detail. So you get way more detail about their perceived or expressed needs. So with focus group, this allows both the researcher and the participant to explore the relevant issues and to provide more in-depth examples or experiences and opinions. Representation in the focus groups should be carefully considered and justified to avoid biasing the results. So you need to make sure that you are getting a representative sample. So making sure that you are getting different people in your focus group, whether you have to make sure you know the community makeup, how many people are in the community. You also need to know maybe race, gender, age group, any demographic characteristics that you can think about, and make sure that you have a variety of people to make sure that you don't bias the results. You can also do a community forum. So you can invite community members to discuss community needs, because this is also an important step in establishing commitment to new services. A community forum is especially useful when a program is thought to be controversial, because individuals who agree to participate are likely to be those who feel strongly about the issue. Whether they strongly agree or they strongly disagree, they are the ones that are probably going to join the community forum. Think of a situation in which the school board in an inner city neighborhood proposes a program in which students who are missing school will be arrested by police and held until their parents pick them up. So, in using a community forum, it may disclose that although parents want their children to attend school every day, they view a policy of arresting their children as harassment of the minority community, and that they strongly support other methods to improve school attendance. Key informant interviews. So, some members of the community may be known as what we call experts. So they may have expertise about the needs and reactions of the community. And interviews with these key informants can provide detailed, in-depth information. So if you're speaking with key informants, you may be able to get way more information about that community and its needs, because these are people who know a lot about the community, and these are people that the community members would go to with their problems, and they would know a lot. And so it would be a good idea to target those people to be able to get more information. The key informants can also help the researcher discover why community members are not using the services that are already available. And your key informants can be any professionals within a community. It can be police, teachers, health specialists, social workers, anyone that has direct experience with the population, and you would want to work with them in order to address these needs. They can also be informal community leaders. They can be elders, religious leaders, business leaders, and activists. So they can be formal or informal leaders within the community. Another thing to think about in terms of your key informant interviews is that you need to have a rationale and justification for using specific key informants. We also have analysis of existing records. So this can be your census data, published reports, police or court records, agency case records, or newspaper accounts. Anything that can provide more information that will help you recognize the needs of that community. For example, doing an analysis of the zip codes of current users of agency services may reveal areas of that community that are not being reached by the programs that you have. Similarly, census data combined with published reports of similar communities may provide information to justify the need for those new services. Whether you're using police reports, whether you're using agency records, court records, whatever existing records you're using, those can be very helpful in determining the need for services in that area. You can also do a mixed method. So basically, it's a combination of approaches. This can also be used to strengthen your approaches. So you can do a combination of these methods. You don't have to just select one of them. Okay, so that's it on needs assessment. Hopefully, this provides some information in terms of how to conduct a needs assessment, what questions to ask, and it's very important that before you just develop a service or just assume that a service or program is needed, that you try to do a needs assessment to determine whether it's in fact needed or if there is a current service or program already available that is not being used or that people just don't know about and can be used.